let's talk about the plumbing, the large intestine. Actually, it's the whole digestive system. So when you think about the digestive system, you have to consider it as one long tube. You have mouth to anus. And so I'm not going to use flowery language there. It can be pretty colorful. But each segment of the digestive system has its own pH. And through a variety of functions, it could be emotional nervous system, it could be diet related, it could be dehydration, not having enough water intake. So some of these detoxification programs make you feel good initially because A, you're increasing your water intake, you are cutting out the sugars and the preservatives and the foods that we know make us feel pretty darn crummy. So automatically these detoxes have a beneficial effect on our energy levels. Now, one of the issues with chronic constipation is that by having the bowels moving too slowly, you can cause a backup of waste. So people with chronic constipation can start to suffer reflux or a backup of acid because each segment like I said, has its own pH, and if one segment fills up, it's going to spill back into a previous segment which functions on a different pH level. So we want to keep the bowels moving. You got to keep that plumbing going. The thing about chronic constipation is that we can have a reuptake or a reabsorption of toxins or waste products, one of which are reproductive hormones. So for, let's say, women who have fibroids or endometriosis or concerns of an estrogenic nature, an excessive estrogenic nature, and keep in mind that we are exposed to excessive estrogens in our food and water in our environment. They act like estrogens, even though they aren't the hormones specifically in our bodies. And we have different substances that disrupt our hormones, but that's a topic for another video. The primary focus on keeping the bowels moving, in addition to obviously eliminating waste, when a detox needs a little more focus, is on women who have these tissue growth issues, which is an estrogen dependent or tissue building process, is that we have a reuptake. So when the bowels don't move on a regular basis, the body reuptakes those used hormones. It's through what we call the enterohepatic recirculation. That means entero is your bowels, hepatic is your liver, so it gets reuptake into the liver and reconstituted back into hormone, which elevates the circulating estrogens. Now, will a 3-day, a 2-week, or a 1-month detox help clear that estrogen buildup? The truth is, it takes longer than that. The reproductive hormones, your adrenal hormones, we function on monthly cycles, and it's not immediate. So these radical detoxes that cause headaches and nausea, they're not ideal when you're looking to be more specific with something like an estrogenic overload. So we can work with your physician if you are in the process of treating fibroids or endometriosis, rather than taking something that will chemically shut down your estrogens. We can look to possibly reduce the estrogens and clear it out over time. So this is a situation where the herbal medicine, in addition to detoxification methods, on a more gentle but a long-term approach, is really your best bet.